Yeah, so welcome everyone. So this is the Promises and Pitfalls of Psychedelic Assisted Therapy, featuring Dr. Dana Lerman. And I've been blessed to have Dr. Dana come into my life a couple years ago and bring her perspective of healing into the world here, from a mainstream medicine doctor to what she's doing now. And it's so exciting with Skylight Psychedelics and all that's happening here, especially in Colorado, with the movement to use psychedelics once again for spiritual growth and for mental health healing. It's such an exciting time, and I can tell there's a lot of people on the call because it is such an exciting topic. So I'm excited to jump in. We want to use our time really wisely. We have about an hour together today. We're going to leave time for questions at the end. And I think we should just jump in with Dr. Dana. Could we just start with a brief introduction of who you are and what Skylight Psychedelics is about, and your role in the movement here towards a resurgence of psychedelics being used for healing?
Yeah, sure. Thank you, Eric, for having me. Hi, guys. Nice to see everybody here, those of you who I can see. I'm Dana Lerman. I am one of the physician co-founders of Skylight Psychedelics. I used to be a COVID doctor, board certified internal medicine and infectious disease. Before the pandemic, I was suffering from a lot of burnout. And then I was actually trying to exit infectious diseases. And then the pandemic happened while I was launching a different company altogether, really just trying to get out. And then I kind of was pulled back into it, felt a moral obligation to use my skill set to help what was this horrendous situation. And then instead of exiting, I decided to launch my own COVID consulting company. And I did that, got tests to people all over the country, got a medical license in every state of the, here. And I also was doing a lot of business risk mitigation and helping businesses stay open. And sure enough, no surprise, I'm sure to all of you, that drove me further into the burnout hole. And in the middle of the pandemic, I decided to go down to Costa Rica and do ayahuasca. So I was in a maloca doing ayahuasca for 4 nights in a row, having shaman spit on me, which is not a very COVID-friendly thing, you would think. But I was able to let go of a lot of my issues and my control. It was a big thing that I was able to surrender. And slowly but surely, I've exited the field of standard Western medicine, really, and infectious disease, really, completely. I don't do that anymore. And now a year ago, I opened up Open Mind Space, which is an intramuscular ketamine practice in Evergreen. And about, I don't even know how long ago now, 4 or 6 months ago, we launched Skylight Psychedelics because I felt like I had a medical license in every state and I can actually do something great for people. And Skylight Psychedelics, what we do is, there are a lot of ketamine companies out there that send ketamine to people's homes, big doses of ketamine, no supervision. And I really felt like learning all of this, I felt like that was really unsafe. And I felt like I could actually make a big difference in this field. I went to, I was trained by the Integrative Psychiatry Institute in Boulder. I did a psychedelic assisted therapy training course over the last year. And I partnered up with an addiction psychiatrist in New York, and we launched Skylight. And so Skylight basically trains therapists to sit with people on ketamine and provide ketamine assisted therapy. And we don't take all your money to do it. So that was a really big part of why I wanted to do this, is because my training course cost me $7,000 and a year. And I've been through a lot of training, and that really just wasn't necessary. And I know it. And most people who take this course who I connect with also say the same thing. The course it's a wonderful course. I'm not saying it doesn't have a place in this world, but it should not be the only thing where therapists can go and get training in how to sit with someone on ketamine. So we
Dana,
offer a
can I
training
hop in
course,
there?
and yeah, sure, go.
For people that are on the call that are new to ketamine, could you give us a description of, so what I see a lot in my therapy practice is with psilocybin as well, is this, there's this use of street drugs, unfortunately, in our culture and they hear ketamine or psychedelics and it kind of freaks people out. How is it safe to use ketamine in this environment? Is that a good time to introduce that maybe too?
Yeah, sure. So ketamine is, it's a dissociative anesthetic medicine that it's fully legal when you get it from a physician. You can also buy it on the street, which is not legal. And it could also be laced with other things that could be dangerous, like fentanyl. So ketamine is a medicine that's been used since I think the 50s, honestly. It was a battlefield anesthetic initially. It's one of the safest medicines that is out there. Like I said, it was initially used for anesthesia and much higher doses. And then in the last 10 years or so plus, they've realized that low dose ketamine has psychedelic properties that allow people to connect with their inner healing intelligence. And it also affects neuroplasticity, neurogenesis, and helps people deal with depression, anxiety, and PTSD and multiple things. So, but in order to provide ketamine, it has to come from a prescriber.
And that's what Skylight is all about. So as a therapist, that's why I am connected with Dr. Dana and her team. Is I work with clients every day who have lots of symptoms that could be helped with psychedelic assisted therapy. And later in the call, we'll get to that part to share logistics about how to navigate both those systems. One is to go through Skylight Psychedelics to be able to be prescribed the medicine to do the journey work, and then to connect with a therapist to sit with you during the process. So just to give a little foreshadowing of how this all works.
Yeah, we not only do we train the therapists, but we prescribe to clients across the country. So, but we are very connected to our clients. We're not just drug dealers, right? We meet with them on telehealth. We send them one dose of medicine. We follow up with them after their first session. We establish what the dosing should be going forward, and then we send them 5 more doses to their house. They take the medicine in their therapist's office only. So it's a very tight container. The therapists meet with us every other week. We discuss complicated cases, all things psychedelic. My business partner, Scott, and I are very involved with all the therapists and really have a very tight-knit community of people who, most of the therapists who come to us are doing their own work, right? They're doing their own work with psychedelic medicine, ketamine, other medicines. And that's also a very important part of this work is, we really feel very strongly that if you are going to give someone this medicine, that you can sit with the medicine yourself before doing so you really understand what it is that they're doing. And also, honestly, because many of us are on our own journeys and have some healing to do.
Yeah, so one of the bullet points on what we want to offer today in this webinar is some of the benefits and if there are any pitfalls of psychedelic assisted therapy. Would you be able to share some of those, Dana, so people know maybe, like what certain things that they're dealing with might be benefited by the medicine, whereas other diagnoses maybe aren't as helpful with psychedelic assisted medicine?
Sure. Yeah. So there's medicines that are more kind of appropriate for certain things, I would say now safely, right? So if someone was actively suicidal, I wouldn't suggest giving them psilocybin, right? I would suggest giving them ketamine because that is the go-to medicine for suicidality because it really works. Ketamine saved my best friend's life. That's why I got into ketamine to begin with. He wrote me, he's a physician, radiation oncologist, very successful guy, suffers from you name it, and wrote me a suicide letter. And luckily we were able to get him to ketamine, and that was a year and a half ago. And so he's still here and so just so much better. It's not a
Can I
magic
hop in there
bullet.
with
A lot of you have to do. Yeah.
I'd love to hop in there too as a therapist. One of the first sessions I got to do with a ketamine assisted therapy, thanks to Dr. Dana's company, there was a suicidal client. And I just remember how remarkable it was. She said she couldn't even access that part of her mind anymore that had those horrible thoughts about how, just really self-destructive thoughts and thoughts about ending her life. Like somehow the ketamine in the work that we did helped her to not even be able to access those destructive parts of her mind. So just wanted to share that. I've seen firsthand as well, the depth of how helpful it could be. So, yeah.
It's amazing. I mean, and sometimes it happens after one session. And with that particular client, I think it did. It was one session. With my friend, it was 4. And so we typically do 6 to 8 sessions of ketamine. But okay, so yeah, so that's one of the main things. And then a lot of people also then go on to do psilocybin journeys once their suicidality is under control, right? And then they can go deeper and experience different things and learn more about, how they got to that place in the first place. Or there's always something that comes up in a psychedelic journey that is beneficial, no matter what happens. There are a lot of pitfalls, and I think a lot of mismanagement can happen out there. I just got off the phone with a client that I was prescribing ketamine to. I just got off a telehealth visit, and he told me that he was with a therapist who is providing, facilitating psilocybin journeys. And we went over his medication list, and he is on Adderall and he is on sertraline. And those are very dangerous to combine with psilocybin. It's not recommended to do that at all. So you really, when you're sitting with someone, if you're a facilitator, psilocybin, or you're going to sit with someone who is going to facilitate for you, it is really important that they know what they're doing, right? That they know medication, that they have done a thorough intake. They know medication interactions. What medical and psychiatric problems could you have that you shouldn't do these medicines, right? Anyone with mania or psychosis, schizophrenia, those are really 3 things that you really want to not introduce psychedelic therapies to. Certainly not as a first line for someone like that. Those are very complicated cases. But also if someone with a family history of schizophrenia, you're not supposed to give them psilocybin. There are so many people out there who are on SSRIs who are eating psilocybin, and what they also don't know is that a lot of times it's not going to work because the SSRIs get in the way of psilocybin, the psilocybin's effect. And so what they end up doing is taking more and more and more, and then they're increasing their risk of a serotonin syndrome, which is rare, but you can die from it and you don't know when it's going to happen. So I don't want to freak everybody out. I'm a huge advocate for psychedelics, psilocybin specifically, but you have to know what you're doing. And you have to also, yeah, go ahead, Eric. All right.
Oh, thank you. Well, this just seems like a great time to, I've interviewed you before, and this time it seems like we're able to talk a little more openly about psilocybin. And I suspect that partially because Proposition 122 is decriminalizing psychedelics here in Colorado, and also the amazing work that MAPS is doing around psilocybin. MAPS is an organization that has been working since the government put this really horrible light on psychedelics to bring it back for a medicinal use. So I wonder if you could give us a little background at this point about what that meant, that Proposition 122 went through, and then anything maybe you know about the exciting work MAPS is doing, just because it feels like we're starting to be able to broaden the conversation, because ketamine is legal, and that's been where we've been kind of restricted to talk about its use. But pretty soon here, hopefully, I guess I'm just sensing from everything you're saying that it's like this brave new world of this third wave of psychedelics being hopefully more and more decriminalized and used for really healthy reasons. But there's a lot of room for misuse and not doing it right. So I guess I'm asking many questions. Sorry, whatever you feel is most important about the legalization and the exciting time we're living in and how it can help people.
It's very exciting, but it's also still very much underground because, so Prop 122, even though it passed, you're still not allowed to do any of those things yet. So not officially, right? And really not until about January 5th, which most people don't know. Luckily, I have become very good friends with Kevin Matthews and his team, and I got to somehow, I figured out how to connect with them, and it's been very helpful because, oh, sorry, Kevin Matthews is the veteran who basically was responsible for helping push along decrim Denver initially, and then now also Prop 122 with Veronica Lightning Horse Perez and there's some other people on that team. So you're not allowed to do any of it now, right? You're not allowed to, in Evergreen for sure. In Denver, it's still obviously decriminalized and that's passed already, but Prop 122 allows a facilitator to be able to sit with someone on psilocybin and not have their medical license at risk because they're doing it, right? You're not allowed to charge someone for the psilocybin, but you can charge them for your services and gift them the psilocybin. So right now you cannot buy psilocybin, even when Prop 122 is in effect, right? Sorry, my dog's trying to get in. You cannot buy psilocybin and you cannot sell psilocybin. You can have enough on you for personal use or gifting or donating, but there's no quantity that has been established in terms of how much that is. So, sorry, can I let my dog in really quickly? She's just banging on the door. Hold on. Sorry, guys.
No, please do. It's so exciting. Dr. Dana last night got to be on a team that spoke at a documentary about psychedelics last night at the Mayan Theater in Denver. It's called Dosed. So it's just so, this topic is so alive right now. And I'm just wanted to repeat how honored I am to have Dr. Dana here. She's just really at the heart of everything that's happening right now. So, yeah.
I kind of sometimes think about how quickly it was that I got to this place, and it's such an unusual, complete transformation, but that's what psychedelics also, that's what they do. And, it's very interesting to me because as a COVID provider in that pandemic, everyone and their mother and then their mother and their best friend would call me about coronavirus, right? Everyone. People I didn't know were calling me for their family because it was such a horrendous, horrific time, right? And they were desperate. And that's what's happening now, to me now in the psychedelic space. It's the same thing, right? So it's, as a psychedelic provider, when you sit with someone in non-ordinary states, it is very labor intensive and it can be very energy sucking. And you really have to be able to protect your energy. And that's going to be something that, when these licensed facilities are able to practice, which is going to be in a while from now, but licensed psilocybin practices, I really feel very strongly that there should be some sort of regulation around how many journeys you could do in a week, because it's like driving a truck all night long. It's not just the time, because even if you're sitting in a journey space with someone who's not even talking, holding space is real. It's like standing there for a surgery. It's a similar thing, but it is just a different kind of energy involvement, but it's a lot. So that's something that I think is really important. Sorry, I didn't mean to get sidetracked.
No, well, I think this might be a good time too to talk about how needed this is, and that's probably why there's such a pent-up need for what's happening right now. Is for example, people who struggle with depression, and then the rates that SSRIs really help is, I heard, roughly equivalent to a placebo. People with PTSD, like just the mainstream Western medical system, or even what we do in mainstream therapy without any psychedelics, maybe hasn't been cutting the mustard. And there's just our culture has so much stuff going on that, gosh, this is going to be an interesting time to to roll out the use of these medicines legally. How are we going to take care of everyone? And I guess maybe it could be fun to speak to what are some of the top diagnoses that you see psychedelic assisted medicines helping with? Maybe I know depression, anxiety, PTSD are some of the big ones.
It's the human condition.
Pretty much.
So that's what it's for, really. You can call it whatever you want. You can call it depression, anxiety, PTSD, suicidality, all these things. I mean, those are just, right, if you're familiar with IFS, like those are parts of us, right? Like you have a suicidal part, depressed part, anxious part, all those things. Like we're so used to labeling people, and I hate that. And it's so hard because as providers, we're like, that's how we communicate. Like, oh, she's a history of depression and anxiety and PTSD and all this stuff. But like, the reality is that every single person has a trauma, right? And whether you were raped as a child or you were smacked on the butt and you didn't know why, like it doesn't matter, right? It's something that it's repression, right? We are all living with repressed trauma, and we are not. And in our society, we don't deal with it. We sweep it under the rug. We drink booze. We smoke weed. We take meds, and we just push it down. And psychedelics are the total opposite. Psychedelics turn on that light, and they go in your body, and they go out throughout you. They do their diagnostics, and they're like, then they turn the light on, and they show you, this is your shit. Let's work on this. I've seen it. I've seen in psilocybin journeys where women were molested by their fathers at a young age, and they always thought something happened, but they couldn't quite put their finger on it, and they didn't know who it was. And then in a psilocybin journey, that comes out. And that's just what happens. And it doesn't happen every time that not every one of us is molested, right? But the trauma comes out. And then you actually get to process it for the first time and move through it, instead of it being just stuck in your body and manifesting in depression, anxiety, PTSD, OCD, all the things.
One of the most amazing things I've seen that I'd love to help us understand better is, so I guess my perception is you do some shadow work when you're on a journey, say, but first, a lot of the times, for me at least, there's this sense that so many people report with psychedelics, is that feeling of oneness, that we are love. In the middle of a journey once, we all looked at each other and said, we're wrapped in something right now. We're held by something, and that is love. And to have that direct experience of safety and love and just such beautiful feelings. And then for shadow work to come up, like the tough stuff that we all deal with, it's almost to me like there's this unification of the two. They meet each other. So those traumatic things that used to be so hard to deal with seem to almost be held in that love and safety. And I think from a neuroscience perspective, maybe that's where they talk about, it can kind of heal neural pathways and make those traumatic memories less intense. And then what I love about working with you, Dana, you've taught me to do we do the 6 medicine sessions, but then we always have 3 minimum integration sessions. So it's like all those things are combining, right? There's this sense of love and safety combined with doing shadow work and then rewriting those neural pathways. It just seems to work so beautifully. Could you speak to that at all? Is that common?
Yeah, I think that we don't talk enough about being witnessed and witnessing the healing, right? That's why I think, sure, people can have really profound journeys on their own, right? Like Paul Stamets ate a huge dose of mushrooms, climbed a tree in a storm, and stopped stuttering, right? I think a lot can be lost when you journey alone, because you can end up in a bad space and unsupported and re-traumatized and things like that. But there's something to be said about journeying in a group, journeying with someone else, because you are being seen in your raw self, and your uninhibited, your true soul is there. And to have that seen is a really big deal. I think that You don't get in any in many other places, right? That's not something that we talk about. But witnessing and being witnessed, I think, is a big part of it. Just like when you do ayahuasca and you're in a maloca full of 50 people vomiting and having diarrhea and crying, you are all together in that, and you are seeing other people in their the darkest, most challenging moments, and they're seeing you, and it just makes this closeness, because it's okay to have emotion and to show emotion, which we, for some reason, we don't want to cry in front of anyone else. We don't want to scream in front of anyone else. We were taught that we have to like keep it all on lock. And that's why we are just all, we all just have so much to come out. You could hear it in a maloca when you hear, it's just like it's unbelievable, the noises that come out of people and the things that come out, the purge that comes out of just years of repression, and not just our own shit, it's a legacy shit that we carry for our parents and that generational trauma, and that all shows up.
How do you, so we've talked so far, it seems, about ketamine, psilocybin, and ayahuasca. Are there other medicines that we should know about as things are being decriminalized? And also, I guess, second part of that question would be, how do you come to terms with the different energies of each medicine? I guess for me, it seems to me like each medicine has its own like spirit or own way to heal. Can you speak to that at all? Like the differences between the different psychedelics and, in an ideal world, as they become more legal to use, or there's underground ways to use these medicines, how do you know which one to use when, and how do you navigate this exciting new world?
Yeah, I think it's helpful to have someone who has an understanding of medicines. And when you're going to do a journey with someone and you're going to be in a new medicine space, to meet with those facilitators, to connect with them, because if you do not trust them, this is not going to go well, right? In a psychedelic space, you have to have three things. You have to trust the medicine, you have to trust your relationship with your facilitator, and you have to trust your own inner healing intelligence. And that those three things is kind of like the hat trick, the trifecta, the holy trinity. You have those things and you're really in a good spot. But doing your research, knowing where the medicine comes from, having respect for the medicine and the origins of those medicines, learning about the process, right? If you're going to smoke 5-MeO DMT, bufo, right? Where does that come from? We're trying to lose the disconnect between humans and medicines and earth, right? We're trying to get back to that, right? So if you're going to smoke 5-MeO DMT, it's really nice to have a good idea of like where that came from, right? That's the Colorado River toad, and it lives most of its life underground, and then it comes up. And how is the DMT harvested? And is that what your facilitators, do they give a shit about that? Are they caring about the frog, or do they just go and take all the venom and leave the frog to die? Right? There's a lot of things that go into, you really just want to do it with intention and know about and just learn about the medicines. And in terms of the spirit of, that's the kind of thing that you learn as you go. I mean, and they all have spirit, and they can communicate inside of you also. If you have, you smoke 5-MeO DMT one day, and then a week later you eat a little marijuana, you may very well find those two medicines kind of almost canoodling inside of you. It's a very interesting thing. And if you have not had that experience, it's hard to kind of understand. And I know I might sound a little crazy, but it's the thing that happens. Like medicines can communicate inside. And all medicines.
Well, so that reminds me. So I want to acknowledge everyone that I bet you have burning questions. I know I do. So we're going to open up to questions really soon. I wanted to give a resource that came to mind. It's called Third Wave. I asked Lauren to put it in. It's just this exceptional website where you can click on each type of psychedelic and learn a ton about each one in a very balanced way, is my perception. And then on Netflix, and there's a book too, it's How to Change Your Mind by Michael Pollan. And that book is the one I recommend all the time to people. I guess there's this fun phrase called the psychonaut, right? People that are starting to explore their minds more through psychedelics, but that's a great starting point, is How to Change Your Mind by Michael Pollan. And then the Netflix series has 6 parts to it, I believe, and I can't believe it exists. It's such a good sign of that psychedelics are mainstreaming for very healthy, good reasons. So yeah, any other resources, Dr. Dana, you'd want to suggest to people? Oh, and I know set and setting is huge, those kind of foundational things that get us understanding this whole world better.
Yeah, so we just actually through Skylight just launched a community psilocybin harm reduction course. I don't know if I said that already on this call. I was just on another call earlier. It's on our website under courses, and it really helps people to understand kind of what's important in a journey, right? This is not just about eating mushrooms at Red Rocks. And I'm not saying that there's anything wrong with that, right? People do that. And mushrooms can be really fun, but they can also be work. And a lot of times when you go to Red Rocks to eat mushrooms, you might find yourself doing work. And that is something that happens. And to be prepared and to understand that that could happen. So we really tried to put together a course that, because when Prop 122 is really legal, there's going to be a lot of people using medicine and they do not know what they're doing. And bad trips don't have to happen. That does not have to happen. Bad trips don't happen when you are with a facilitator who knows what they're doing. Bad trips don't happen when you're prepared and you have somebody who's there for you. Difficult experiences can happen for sure. And that's very different, right? But a bad trip is you eat a bunch of mushrooms, you go to Red Rocks and everyone turns into the devil and you melt into the ground and everything is horrendous, right? That can happen because you're in an unsupported environment. You don't have anyone to help you, and you're just stuck. But, when you're in a facilitator space and she turns into the devil and you start melting into the ground, you can ask for help, right? And then that person is there. If they're trained, they know how to help you through that moment. And then that difficult experience can be one of the most biggest opportunities in your journey.
Fantastic. So before so there's 2 parts left to the call that I'd like to get to. One is just to give logistics. I guess I could do that right now. So if anyone out there is interested in in doing ketamine assisted therapy, which is currently legal, you would go to Dr. Dana's website. And Lauren already put that in the chat, Skylight Psychedelics. You go through that process with Dr. Dana's team. It's done very safely, and you get your first prescription just for the first session. And then you come into the therapist's office. It could be any of the therapists that are all set up through Skylight. How many do we have now with Skylight? How many therapists?
Over, I think
200?
Over 200.
Wow.
Maybe about 200.
I was one of the first handful. I'm honored. This is really moving quickly, isn't it? So we go through Dr. Dana's training, and then we're ready to sit with you for your 6 sessions on the medicine, and then 3 integration sessions. And any of the therapists on the website are just ready to be with you. And ideally, you already are with a therapist who you have rapport with, even that if they could even maybe do the training if they're not yet. Because I know I've had current clients who want to do the medicine that kind of already know me and have trust. And that's a beautiful thing as a therapist.
It's so important, I think, to have, there's these companies out there that make you sit their therapists, and that's a really big deal. People have been working for years with therapists, and to have to go through such a deep experience with someone who you don't have that relationship with, I think is a really big deal. But also integration, when you talk about integration, I was talking with one of our therapists yesterday about it, and there's no end point to integration. It is ongoing and forever. That is just, it's not like one day you're like, oh yeah, I fully integrated that experience. No, it just keeps coming. And after psychedelic experiences, you continue to get downloads after the experience. Things start coming together and you're putting it all together. So I never like to say that there's an endpoint to integration. Cool. And it's also important that integration, for therapists to understand that integration does not mean interpretation, right? It is not up to the therapist to interpret someone's journey. That's part of their work and putting it all together. So even though sometimes you want to just hit them over the head and say, can't you see it's this? You have to kind of just hold back and just let them figure it out.
Yeah, what I love that as a therapist, we've been trained, is it WAIT, the acronym? Why am I talking?
Yeah.
And I've learned that is my main thing as a I believe I'm a good therapist, is just loving people and listening, you know, and letting them do their work. But when you add psychedelics, forget about it. They have all the answers. I got to journey with you, and I'll never forget how little you said and how supportive it was. I just kept needing to vent and process, and you just kept affirming that that's what I should be doing. Just go towards the work. You're safe. That's all you really needed to do. And it was beautiful, because I realized this is a thing of Buddhism that influences my practices, is we all have Buddha nature. We all know all the answers inside, deep inside. We're all okay. We got this, you know, we all have that same truth. And the medicine seems, with a good provider that will allow you to do that work, it's so true that you don't need to do much except just be there, and almost like a holding hand through the journey. I love this work.
I really agree. Yeah. I mean, it's my philosophy that the psychedelic landscape is no place for a therapist to be tinkering in someone's psychedelic landscape. And really, I feel that supporting and providing that space and being there for them when they need you to intervene, but doing deep psychotherapy in that space can get really dangerous. And I think that the therapy part is really is great in the integration. And people on psychedelic medicine are so vulnerable, right? They're so vulnerable.
A little bit more of the logistics too, because I know people who haven't done ketamine assisted therapy, I hear a lot of the similar questions. So how we do it in the therapist office is sublingual, under the tongue. You come in, and Dr. Dana could talk more about this probably, but you just check that your heart rate is in a certain place. And if it's safe and good to go, then we jump in, and I personally lock the door and make sure everyone feels totally safe in my space. I have lots of plants that you can see around. I even have a little fire there going for you guys, and you lie down. And then I have a beautiful sound system that Dr. Jana provides playlists, and they're really beautiful playlists. If you just want to check them out on Spotify, they're available. Skylight Psychedelics. There's a unique one for each journey. It's so cool. We pretty much just hit play, and you just experience the medicine. It hits for most people within maybe 3 to 5 minutes. And then there's it seems to be a nice little peak, maybe around 15 or 20. And then you start to chill out a little more. And then you have as much time as you need in the office to kind of come down. And that's just to give a little logistics. Did I miss anything about what it might be like to do ketamine assisted therapy? Oh, I should say, usually in the beginning of the journey, most people seem to go deep within when it's most strong, I've noticed. And then a lot of people start to want to process a little bit and talk more. But everyone's unique, of course. Yeah. What else do you see?
You know, I think, I think the sun is shifting and it's getting dark here. I think that's pretty accurate. You know, we want to make sure that their blood pressure is in a safe space before giving ketamine. That's something that's important. And yeah, people really, you know, it depends on where they are in their dosing. Usually we start off at 100 milligrams of sublingual ketamine, and we increase from there. But 100 milligrams seems to really be a nice starting point for most people, because, you know, especially those who are not familiar with these non-ordinary states of consciousness, it's a nice, like, kind of entry into this space. And then you see that the deeper stuff just kind of just bubbles up. That's just what happens. And sometimes there's challenging patients, and, you know, interesting things happen. And Eric has been one of the therapists that we've worked with where, you know, he's gotten a challenging case. And I think it's really important, if you're interested in working with psychedelic medicines and you have your first clients, it's try not to choose a very complicated client, right, to begin with. That's an important thing. You know, someone who just has what seems to be some relatively mild issues going on, and just so you can get your feet wet and kind of learn how to sit in a space like that, and then working with more kind of deeper, bigger things.
I think one of the most valuable things I've noticed is as people share whatever's going on, and when they're on the medicine, they may not remember afterwards. And I see it as my job just to take great notes. And in integration, it's really wonderful to help them make meaning of what they experienced. And I've experienced that personally with you too, as a great note taker, and to help integrate. So that seemed important to mention too.
Yeah, I definitely think that's a nice thing to offer someone. And I think it can be helpful in integration. But I also like to share this, something that someone told me a long time ago, is that everything is recorded. So when you're in a psychedelic space, it's all recorded and you already.
Right on. So we covered all our basic, the main bullet points, and I'm sure there's some burning questions out there. Lauren, unless Dana, did I miss anything, or do you want to take some questions and then go from there?
Yeah, I'm happy to answer any questions to the best of my ability, for sure.
Yeah. Lauren, did you want to facilitate that part?
I sent you questions in the chat directly to each of you. And I also just wanted to mention to everyone on to submit your questions in the chat, and then I'll send them to either Eric or Dana or both.
Okay.
Okay, so I'm physically located in Evergreen. Just so you are aware. Okay, Dana, where are you physically located? Just so you are aware, when presenting to us in Colorado, ketamine has gotten really bad press in relation to the high-profile case. Yeah, right. So I'm very familiar with this case of Elijah McClain, who this is a young, I believe he was a young autistic African-American boy who was, I think he was like 15 years old. And he had headphones on, and someone was concerned he was doing something wrong, and somehow EMS and the police were involved, and he got, they asked him to stop what he was doing, but he couldn't hear anyone because he had headphones on, but no one knew that. And then he got, the EMS gave him a large dose of ketamine. So that's a very this is basically, I actually know some of the EMS guys who know the people who were in this situation. This is a very big outlier of a situation where this was basically a murder. This young boy was murdered, and that's what happened. The ketamine, that whether or not the ketamine caused his death is hard to say. I know ketamine got bad press about this, but this is, I mean, most people know that when you're using ketamine, I would think that most people are aware that when you're using ketamine in a doctor's office by people who are trained to do it, and you would think these people were trained or should have known what they were doing with this young boy. But that's, you know, that's one of those outlier cases, right? And that's what's going to happen in the world of psychedelics, is not immune to people doing weird shit, right? We have bad people out there in psychedelic medicine. That is a thing. There are people, even in the MAPS trials. There's a video out there of someone in the MAPS clinical trials doing MDMA with a young woman who had a history of sexual assault, and this male and female facilitator who worked with MAPS. The man was completely wildly inappropriate with this young girl, got into bed with her, telling her to spread her legs, like crazy stuff, had a relationship with her after the experience, like everything you're not supposed to do, they were doing. And so MAPS got a ton of bad press, but you know, they moved past it. They're just, that's just going to happen. You have, you know, things like this are going to happen, and hopefully they don't ruin it for everybody else. But sexual touch, and touch is also a really big concept in psychedelic medicine, and is a really huge deal. And you have to really have a conversation with your client before every session, because touching someone without their consent is not ever appropriate. And I never touch anyone in my space without asking them before I gave them medicine and during the medicine. I ask again, and I don't ever touch anyone unless they ask me to hold their hand, put a hand on their head, hand on their shoulder, a hug, but anything else is not appropriate. Okay. I work with folks following violent trauma from mass shootings. I've actually had some clients with that. So if anyone was interested in doing ketamine with a therapist, then they can just go to skylightpsychedelics.com and they fill out the information. If their therapist is not trained, the therapist can go to skylightpsychedelics.com and do the training, and people can complete our training course in a day. You can get through the material in a day. I don't ever recommend anyone rush through it. It's an important thing to go slow. So if it takes you longer than that, then that's how long it takes you. It's also only $500, where I told you my course was $7,000. But we pulled material that we felt is what people really need to know in these spaces. The other thing a lot of therapists don't know is that in these big training programs, they don't teach you how to do the therapy. That doesn't happen. You already know how to do the therapy. It's your therapy that you do, and you're applying that in an integration session is what's basically happening. They teach you in these big courses how to hold space for someone on medicine, which you don't need a year to learn. So that's where we're coming from. The next one is, I've been struggling with alcohol for a very long time. How can this assist with my journey away from that being used as a solution to my mental distress? So psychedelics, including ketamine, are being used to treat addiction, various addictions, right? Because addiction does not occur in a vacuum. You don't just wake up and you're just addicted to something. Something brought you to that place. Something happened to you that led you to be addicted, right? And psychedelics work for that because they bring you back to why you got there in the first place. So that's ketamine, that's all of the different medicines. And many people come to ketamine or psychedelics for another reason and end up like having a total distaste for alcohol. Like, I can't drink alcohol anymore. I have no taste for alcohol. And that happens to a lot of people. It also happened to my best friend whose life was saved with ketamine. He used to drink gin every night. Doesn't drink it anymore at all. It doesn't help everybody. None of these things are 100%, right? Nothing is. But there's a lot of things that you have to do to kind of make it stick, right? You have to prepare. You have to know who you're with. You have to do the work in the journey. You have to do the integration. You have to go outside. You got to stop watching the fucking news, right? Like, you got to get back to the earth and our connection to people and who we are. And right. I mean, we were not meant to take on the traumas of the entire world. And that's what we are doing when we watch the news. That's what's happening, right? So we're not equipped for that. It affects us, even though you feel like it doesn't. It's a really interesting thing. Okay. Let me see. Can ketamine help with adult ADHD? I don't know data in terms of that, but a lot of people are using psychedelic medicines for ADHD. But also with the important caveat of them having to be off ADHD medicines because it can cause an issue with serotonin. Let's see. Someone had mentioned the TV show Hamilton's Pharmacopoeia is a quirky but interesting introduction to many plant medicines. Let's see. Okay, hold on.
Dana, if you go to your direct message, I'm sending the questions to you directly.
Let me see how to do that.
So it'd be from Lauren to you.
Okay, yeah, no, I see that. Can you remind us what the preferences are for timing or scheduling of sessions? Are we talking about ketamine or psilocybin? I don't know. I'll just answer both.
Okay,
so
she just responded that she just starting as a patient. Do you mean
okay.
ketamine or?
So as a patient, I'll also speak to both. So ketamine, for people who are interested in doing ketamine therapy, what we typically do is, so someone would evaluate, if you're interested in working with Skylight, you would fill out the medical intake form. There are two physicians one of which would read the medical intake form and approve you or not approve you for therapy. most people get approved because there's very few contraindications to ketamine therapy. If we do not approve you, we do not take your money. We only are, accepting payment once we are doing the telehealth visit and are actually starting to do the work for the client, right? And then basically what would happen is then our team within a week's time would set you up with a telehealth visit. And then you would have to make sure that you have a therapist who is trained by us, because we give very specific training. We want to make sure that the therapists understand what we think is important. And then, sorry, there's some noise in the background here. And then then the pharmacy ships the medicine within 3 to 4 days of you being seen in the telehealth visit. So it's a very quick thing. And when you're with your therapist, usually sessions are 2 hours, because most therapists are doing an hour on the medicine and then an hour of, deep connection and integration. Some therapists do 3-hour sessions. It's variable. But we do recommend doing 6 of those sessions for ketamine. And then psilocybin is a different story. Some people do a psilocybin journey a year, every 6 months. It just depends on what it is that they need. And those journeys last much longer than ketamine. Ketamine's an hour on the medicine, and psilocybin's usually about 6 hours on the medicine.
And maybe that's a good time just to get real logistical. I have had people ask, can they use their insurance for the Skylight Psychedelics part at all? Or?
No, unfortunately, no. Most insurances are not covering ketamine. So that's an issue for people. But we really try to also offset that, because we are the least expensive ketamine provider that exists in the country. So you have a medical intake, you have a phone call with the physician after your first dose, you have 6 doses of ketamine shipped to your door. All of the music, the shipping is included. We have a yoga integration platform that is available to you, and all of that is for $600. And if you ever are struggling with something's going on, and you need to connect with the physicians, you email us and we connect with you. And you have access to our pharmacy, all of it. So,
and on
someone asked a question
side,
about MDMA. Yeah, sorry.
Well, on the therapy side, I've been able to bill some of it through insurance, which has been great. And I'm learning more about how that process works. Definitely the integration sessions when there's no medicine taken. So I've been able to help keep the cost down that way for people.
Yeah. MDMA and mushrooms. Yeah, so there are plenty of people who really enjoy that combination. Does the risk of serotonin syndrome increase? For sure, because psilocybin and MDMA both increase serotonin. So there's not going to be any physician who is going to tell you that you can safely take MDMA and psilocybin, but that physician may very well take it themselves. That's all I can say about that. I mean, there's not a lot of information. There's not a lot of data. There's not a lot of, you don't hear about people being rushed to the hospital with serotonin syndrome because they ate MDMA mushrooms. It's not like this rampant issue of that happening, but we also just don't know. So until we have more information on, how much MDMA do you have to have, how much psilocybin do you have to get into that place of concern. Also, we don't yet know, when you eat mushrooms, you have no idea the psilocybin or psilocin content in the mushroom, right? We will know that very soon, because there are a lot of labs that are working on establishing that. But that's an issue. So when you eat mushrooms, not all mushrooms are created equal, right? There are some strains that have very small psilocybin content, and some that are really strong, like penis envy. Penis envy mushroom is a really strong mushroom. There are ones that are even more intense than that. But knowing kind of where your mushrooms come from, and that's an important thing.
Mm-hmm. And just to check in on time, we know that you only have till 1, Dr. Dana, so we're at 12:55. So if there's any burning questions that we want to answer, and also just to mention, if you're in the Colorado area, Lauren could put this in the chat probably, Awake Mindful Therapy is my practice. And if you want to do this work here in Colorado, but there's so many therapists that are now ready all over the country. So that's through the Skylight Psychedelics website. Is there a place where they can see all the therapists who are now trained on your site?
Yeah, there's so there are prescribing therapists. So therapists who get trained with us don't immediately use us as a prescriber, right? So some therapists just come to us for training and aren't ready to yet do the have us do the prescribing. Everyone's in kind of a different part of their journey in terms of facilitating. But there is a list of some of the certified providers on our website. Yeah, that's easy to find on there.
Cool. Yeah, so any last burning questions from anyone, or do you see anything in the chat, Dana, that seems like, oh, we got to get to this?
Hold on. I think, could this help with sleep issues, like not being able to sleep through the night? Yeah, so a lot of people use psychedelic medicines, including ketamine, to deal with insomnia. Once you've established that it's not because you have 5 cups of coffee, or it's because you did psilocybin and can't sleep, or LSD, or any of those things, and once you actually have a real sleep disorder, there's a reason why, right? I'll read this last one maybe. I have a friend in the medical community that said that a study about microdosing showed that it doesn't work because a key part of the effectiveness is having the mind perceptively altered. Do you have any opinion about this? I mean, the question is work how? Work on what? Work, right? I mean, we don't know enough about microdosing. I'm not familiar with this study exactly, but there's a lot of people doing a lot of different things around microdosing, right? Like Paul Stamets has the Stamets stack, which is psilocybin, a microdose, which a lot of people also don't know what a microdose is. It's a sub-perceptual dose, so you don't feel it, right? It's 0.1 to 0.2 grams of psilocybin. It's a very low dose. And Paul Stamets suggests that if you take that for 4 days with a small amount of lion's mane and also niacin, that this combination can be very beneficial for various reasons. And he has a whole thing on his website, but 4 days on and 3 days off, because you can develop a tolerance, right? So tolerance in psychedelics is very common with ketamine, with really all of them, not ayahuasca.
Well, fantastic. And, yeah, I think we're coming up on our time, and a huge thank you to Dr. Dana and for everyone who took valuable time out of their day to learn about all this amazing information. We've mentioned many times all the places you can go to learn more. So Skylight Psychedelics, Awake Mindful Therapy here in Evergreen, if you're local, for the therapy part. Gosh, we mentioned some great resources, and with How to Change Your Mind, the Netflix series and the book. Gosh, we're off on an incredible journey here together. And what we're going to do is in 10 minutes, I'll get an email and it will have the recording there too. We'll share it that way, and we'll stay in touch. So I guess that's it for today. Thank you, Dr. Dana.
Thanks guys for listening. Thank you. Thanks for your questions.
All right.
Thanks, Eric.
Everyone, have a great day. Honored to be here with you, and look forward to supporting you in your journey and continuing down this road together. Bye-bye.
Here, guys.